to Wellness Wednesday. Our docs are here to answer your health and wellness questions. Please welcome back Dr. Sean West from Primera Blue Cross and Dr. Steve Kirtland from Virginia Mason. Good to have you both here. Dr. West, let me start with you. Let's talk about advice for choosing a primary care physician. This is somebody you're going to see a lot. They're going to get to know you. What do you need to be looking for?
Well, it's always good to check with your plan to make sure that provider is in your network. And so, for example, Virginia Mason is in our personal care plan network, so that would work well. And then oftentimes providers have bios online where you can kind of see what is it about them that might relate to you, what are their focus areas. And then oftentimes it's good to just have an appointment and really have that experience to make sure that you connect with them, because it's really important that you feel like there's good communication. And
can you make an appointment just to kind of check in, or just to say, look, I'm looking for a primary care physician, can you spend 5-10 minutes with me, let's talk?
Some providers will do that, not everybody, but I think it's something you can ask to call in and say, do you offer that type of appointment?
So if you had a problem that's sort of outside what we typically think of as just your family doctor care, like a mental health challenge, anxiety, depression, we're seeing lots of that in kids and adults. Is that something you can start with your primary care physician to
Absolutely,
try to treat?
Absolutely. That's the best place to start. The majority of behavioral health and mental health care actually occurs in primary care. So primary care providers are very comfortable at assessing and treating. And then if there's a need to refer on to a specialist, they can help you navigate that system.
Right, if you need to go
if you
to
do
a
need
specialist.
to, absolutely.
Dr. Kirtland, let's talk about smoking cessation. We talked about all the people who have smoked, and so you can't change that, but if you are smoking now and you need help to stop, what's available?
Well, back
go
to
your
the primary care
care
provider. They're the ones that have the first touch. But there are a number of aids out there to help you stop smoking, so whether it be medication or nicotine replacement patches, things like that. There's a lot of different avenues, and they're very successful. I think that for a while there they got a bad rap, but they're effective.
So what are some of the other risk factors for lung cancer? We know smoking, but then there are people who get it who've never smoked.
Right. Thanks for asking that, because we know that genetics are important. So first-degree relatives, we know secondhand smoke exposure, radon, nickel, other occupational exposures like asbestos, all those have increased your risk of developing lung cancer.
So those are good things for us to think about. And you mentioned that the screening is more of a program, it's not just kind of a one-time thing. Tell me about that.
Right. So a lot of people think it's I go in, I get one CAT scan and I'm done, but actually it's an annual screen, because this year you may have had a normal CAT scan, but next year the cancer may have developed in that year.
Right. And
that's where we're going to, as the program goes on, your ability to pick up the early lung cancers go up. And that's where we're going to really make impact, is catching the early lung cancers.
But let's talk about survival rates, because lung cancer has had, not great survival rates in the past. What are we looking at these days?
Well, unfortunately, overall survival has gone, what we call 5-year survival has increased only from about 15% to 18%. Not a lot in the past 40 years.
Why is that?
Well, the majority is because most lung cancers are picked up at advanced stage after it's already spread outside of the lung.
Right.
Hopefully, with early lung cancer screening, we're going to pick up those early cancers and we're going to have a stage shift. The other exciting thing, though, is even care in the advanced stage has gotten much better. So now patients that may have advanced stage cancer, they're getting new therapies that are coming available almost every other month. There's a new genetic, molecular, targeted therapy that's become available, and we've had some tremendous rates. I've had patients with what we call stage 4 advanced disease that are now alive 7, 8, 9 years.
Wow. So increasing their life and their quality of life while they're doing this. Let's talk about primary care again. Just a quick question about how you get ready for a doctor visit. If you're, in fact, I'm asking this for myself because my primary care physician has gone on maternity leave, so I'm going to see a new person. What should I be thinking about to say to this person to see if we're a good match and to get started? Well, I love getting two things in one.
Well, it's a great question. I think it's really good to know what you would like to accomplish in the visit. So whether it's with a new doctor or maybe your existing provider, it's good to make sure you have your medication list up to date to bring, because most of the time they're going to ask, okay, has anything changed, and to make sure that they know what's going on. It's good to, if you have questions, have a list of questions, and then you and your provider can prioritize those to make sure you get to the ones that are most important, if not through all of them. And then it's actually often good to bring somebody with you, especially if you're, if you're going, might want to go with parents or obviously with children, to have that second set of ears, because sometimes you're not always remembering everything that occurs at the visit.
Right. Maybe take a few notes. How do you know how much time is reasonable to spend? I mean, obviously I don't want to come with 100 questions. What's a reasonable amount of things to ask somebody at an initial appointment? Yeah,
I think it's good to think ahead. If you have something that's relatively straightforward, like a cold, that's kind of a typical thing. If you know that you're, let's say, having issues with depression or something else that might take more time, it's really great to let the office know so that they can make sure that you do have the time to talk about that.
I hadn't really thought about that. So maybe when you make the appointment, say, here are the things that are concerning me, so that they can make a plan around that, or tell you if that will fit in the allotted time.
Yeah, the provider really wants to have that time to talk to you about those things.
Right. All right. Thank you very much. Appreciate you both very much. I'm glad there are new therapies and new ways to approach lung cancer, and I think that'll encourage people who might otherwise have resisted being screening to come in and get it done.
Well, thanks for having us.
Thank you both. We'll be right back.